Today, very interesting discussion. So delighted that Dr. Philip Miller is here with us. Dr. Miller has practiced internal medicine and cardiology for 34 years. He's been with Wake Internal Medicine Consultants. He now works as a part-time physician with MEPS, which is called Military Entrance Processing Station. I'm sure he's going to explain to us exactly what that group does. He is the past chairman for the Wake County Medical Center, as well as past president for the medical staff at Rex Hospital. He's a past chairman for the Rex Heart Committee, as well as board of director and vice president for the Carolina Physicians Health Plan. Quite an impressive career and in public service and medicine. He's taught at the University of North Carolina School of Medicine as an associate clinical professor with research experience, get this, cardiovascular research for hypertension, arrhythmia, congestive heart failure, intermittent claudication studies, I believe that's how it's pronounced, as well as general medicine studies for migraines, lower back pain, osteoarthritis, and osteoporosis. So after this speech, I have a feeling you'll be bombarded by folks maybe with some personal questions. But today he's going to be speaking about a very, very serious issue for all of us, post-traumatic stress disorder and lobotomy. With that, I give you Dr. Philip Miller.
Thank you, Donna, and thanks for this big crowd, especially thanks to my wife who brought the cheering squad over there. Welcome. I might add that all of these people are planning to attend the Charles Krauthammer lecture on February the 7th, and so they're all loyal to us. I want to tell you why I got interested in this topic. Number one, I am a volunteer physician at the Healing Place here in Raleigh, which is a wonderful organization that takes care of men and women who have psychiatric problems from drug addiction, primarily crack cocaine and alcohol. I just work in a medical clinic, don't do any psychiatric work at all. And then the other thing, since I retired 7 years ago, I worked part-time, as Donna said, for MEPS. And that is the processing station for all recruits who are entering the military. This is an important job, and by the way, it costs you, the taxpayer, $40,000 before a recruit gets to Camp Lejeune or wherever he or she is going to be trained. Our job is even more important as we look at not only medical issues, but predisposing issues that might lead to an event like the Major Hassan incident in Texas. I think that was workplace violence. I think that's what they call it now. But at any rate, we go to great extent and take very seriously any predisposing issue that might make a candidate be unstable. For instance, we look at their history of drug enforcement, whether they've had any problems with drugs, arrest, truancy from school, have they been suspended from school. So any of these things, in addition to ADHD and other issues, might disqualify from the military. So with that in mind, and then having seen a series in the Wall Street Journal last December when America lobotomized its vets, I put together a topic which I presented to a medical group, and then I thought it might be of interest to you. Now you see here I've got PTSD, and that's the main focus today, but there are a lot of other things there that come in to play, and lobotomy is one of them, and I'm going to do my best to try to tie all of this together for you. Let me just give you some basic information about PTSD, post-traumatic stress disorder. What one has to have to qualify for this diagnosis or these conditions, re-experiencing. An example of that are nightmares and flashbacks, hyperarousal, that manifests as anxiety and sleeplessness, and phobias, avoidance or for instance, or fear of driving. And this is just basic definitions that you need to know. It's not just combat exposure that can lead to PTSD. Any overwhelming calamity, for instance, rape, assault, accident, or natural disaster. So it's not just military. Most who experience PTSD recover with time. 50% of Vietnam veterans diagnosed with PTSD fully recover with time. 18 to 20% of combat veterans of all wars in the 20th century experienced PTSD. By the advent of World War II, military psychiatrists believed that even the bravest and fittest soldier could endure only so much stress, and concluded that every man has his breaking point. In 1980, the American Psychiatric Association adopted PTSD as an official diagnosis in its Diagnostic and Statistical Manual, DSM. All physicians are familiar with this. According to the DSM, a patient could be diagnosed with PTSD if he experienced a trauma or stressor that would evoke symptoms of distress in most people. For instance, any combat incident, for talking about the military. Now, of note, just recently, it's been found, especially preponderance in those who have had any brain damage during battle. For instance, an IED explosion in a tank or a landmine. A brain injury really predisposes soldiers to this injury. While the major symptoms are fairly straightforward, re-experiencing anxiety, avoidance, what counted as a traumatic experience has turned out to be a moving target in subsequent editions. The issue has become broader and broader as victims of non-combat stress seek a diagnosis of PTSD for personal gain. In the military, it might be something that one would say, I've tried to get a PTSD diagnosis so that he or she could then get a service-connected disability. Or in the workplace, one might have this diagnosis and then be able to get on disability and not have to work. Now, this is really interesting. This fella, Senator John Walsh, or I should say ex-Senator John Walsh. Now, to give you a little historical perspective, early this year, Max Baucus of Montana, longtime Democratic senator, decided not to seek re-election. So he was convinced to take a plum job as the ambassador to China if he would go ahead and resign immediately, so that the lieutenant governor, then John Walsh, could be appointed as the senator, the Democratic senator from Montana. This was done, and so he was in a very nice position to take the state blue again in 2 weeks. Well, very interestingly enough, while my wife and I were in Montana this summer in July, the New York Times, of all people, came out with this article exposing Senator Walsh as having plagiarized his thesis in the War College in 2007. He now right away denied it, but then admitted it, and he said, oh yeah, it was because of PTSD. He is an Iraqi war veteran, and he was in the tanks, and he may have had a battlefield injury, but at any rate, he was trying to manipulate the system. Well, there was a hue and outcry, and he resigned. And the Republican Daines, who's a congressman, I believe now, is ahead 20 points, and will take the state red. Just in the past month, the military, the War College, has revoked his master's thesis, saying that, okay, he might have PTSD, but a whole lot of people have PTSD, and that's no reason to lie and plagiarize. So that's an example of how it can work both ways. As we move on into the 20th century and talk about combat fatigue, I want to show you some footage, actual footage from World War I combat fatigue. Now, I want you to know that during World War I, combat fatigue, desertion was punishable by a firing squad at times. There was no effective treatment at all, and it was a horrible thing, and it was looked at as cowardice then, not, you know, something that could happen to any person. So let me show you this footage. I think you'll be very impressed. This is combat fatigue. And I don't know if, yeah.
When the weather turned bad, did Haig call off the battle? The Allied army had advanced exactly 6 miles. 4 miles short of the objective Haig's cavalry had hoped to take on the opening day. Just like Verdun, the Battle of the Somme resulted in 1 billion casualties. And the battle lines hardly changed at all. Shell shock represented a kind of mutiny, a personal withdrawal from an intolerable reality. Not all, or even most soldiers, suffered from shell shock, but those who did were sobering examples of what mechanized warfare could do to human beings. Rifleman Arthur Russell was, or had been, a magnificent specimen of manhood, 6 feet tall. There was not a mark on him, yet he was helpless as a child. When I returned about a month later, I found Russell trying to walk. His speech was slowly returning, a slow, halting speech full of stammers. But I doubt if he ever again became a fully fit man. Symptoms were often tied to an event on the battlefield. The soldier who bayoneted an enemy in the face developed a facial tic. This man responded to nothing, except the word bomb, which sent him scurrying under the bed. This French soldier became hysterical at the sight of an officer's red hat. Treatment for most enlisted men involved rest and recuperation.
There is some extraordinary material about the way in which soldiers who were incapable of acting were taught first to sew, then to weave, then to farm, then to carry a gun, and then to shoot it again. As if they're moving from a kind of feminine recuperation to masculine combat status. Now you can go back to the men's war.
The worst cases left doctors grasping for solutions. Electric shock treatment was applied to thousands. Some improved. For the rest, the pain of treatment only added to their misery. But this was not the only experimental method of treating shell shock.
You see, it was a real serious, horrible entity. Let's move on now into the World War II era, and here we have General George Patton. And he was the best example of the tough soldier, and you can see what he said there. This is just one of his many quotes. "We're not just going to shoot the bastards, we're going to cut out their living guts and use them to grease the treads of our tanks." You probably are aware of the incident in Sicily in 1943 when Patton was visiting battlefield hospitals. On 2 different occasions, he encountered soldiers in the hospitals who he deemed to be well, he confronted them, and they just trembling, and said they just couldn't take the battlefield. And he called them yellow bastards and told them to get back into combat. Well, this got into the news media. General Eisenhower had to deal with it, and it was a very serious issue. He made General Patton apologize, which he did publicly to these soldiers, but General Eisenhower knew that he had to keep him out of the spotlight, so he was really sidelined for, Patton wanted to take on the invasion of Normandy. He didn't get to do that, but he was brought in late 1944, and he led the Third Army up and relieved the siege at Bastogne and was instrumental in the Battle of the Bulge. But Patton was one who really didn't believe in shell shock and combat fatigue. And I want to just give you a little perspective now on what was evolving about what to do with these. You got to understand, by the end of World War II, there were over 1 million psychiatric mental illness casualties, whereas there were about 500,000 medical issues. So the government and the VA had to deal with this and how to do what. There were no medications. What to do? Electroshock, that was the only other thing. It had been known, though, since the 19th century that destruction of the brain or parts of the brain could alter behavior, particularly the frontal lobe of the brain. Now, this is a very famous, well-known case, Phineas Gage. In 1848, while working in Vermont constructing a railroad, he was using this very metal rod to damp in place, am I coming through now? Damp in place a dynamite charge, and there was a spark, and this damping rod was thrown out of the ground, out of the rock, and it penetrated his face on the left side, went behind his left eye, and exited through his skull. Miraculously, he survived and lived for about 15 years, but there was a dramatic change in his personality. He lost all social inhibition. He had been a diligent, conscientious construction worker before, but after this, he didn't care. He was irresponsible, not dependable, cursed all the time, no social inhibition. It was like he reverted to childhood. Well, medical people became aware of the fact that destruction of the frontal lobe of the brain could result in a personality change, and this was thought to be a possible treatment and cure for shell shock or for any other mental illnesses. And then this doctor, Dr. Walter Friedman, entered the picture. Now, I'm going to show you some footage here, and if you're faint of heart, just leave the room. But this is actual footage, and I think you'll find it interesting.
He was an idealistic doctor, hungry for fame, who would champion one of the century's most infamous medical procedures.
He wanted to solve the problems of psychiatry, and he wanted to do it fast.
The lesson here is not how a man can go off the rails, but it's how science can go off the rails.
Ellen Ionesco was the first patient to undergo a procedure Dr. Freeman had perfected only weeks before. He called it transorbital lobotomy.
In a transorbital lobotomy, Freeman would first have the patient rendered unconscious through the use of the electroconvulsive shock machine.
Just before he threw the switch, we all had to lay on our hands and went for a little ride.
Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger.
The patient would then enter unconsciousness for a relatively brief period of several minutes.
Now that the convulsion has subsided, the nurse holds a towel over the nose and mouth of the patient.
Freeman would peel back each eyelid, insert his ice pick, and with a hammer,
Notice no gloves. No gloves.
sever the frontal lobes, withdraw it, and when the patient came to, he or she would be given dark glasses to hide the black eyes that were given.
We didn't have a refrigerator, we had an ice box. The first ice picks came right out of our kitchen drawer, and they worked like a charm.
Turning now to the operation itself, very little preparation is necessary for transorbital lobotomy.
The instrument was put in above the eyeball and in the plane of the nose. You could feel it hit the roof of the orbit, and then with a tap of a hammer you could knock it through. The whole thing would take 3 or 4 minutes.
This patient came to the hospital this morning after breakfast, and he will leave tomorrow afternoon.
There are reports which he proudly writes down in his diary about fellow professionals fainting as he proceeds in this, or vomiting.
Dr. Watts didn't say anything. He simply turned around and walked out. Spurred on by Freeman, the number of lobotomies performed annually soared from 150 in 1945 to over 5,000 in 1949. Despite the known side effects, there seemed to be an endless supply of willing patients. Ultimately, the fate of lobotomy would be settled by a pill. In 1954, a new drug called Thorazine began to sweep through state mental hospitals.
Thorazine was initially marketed as a chemical lobotomy. I mean, this was seen as a selling point that it produced results similar to lobotomy, but without, of course, all the risks of the surgery.
Freeman decided to move to Los Altos, California, to resurrect his career. Far from the reproachful Eastern medical establishment, he could try to bring lobotomy to new categories of patients.
If housewives found their early 1950s existence too depressing for words, why Freeman had a solution that would get them through their day happy as little clams. If children were misbehaving, conditions we might now see being called hyperactivity disorder, why they might need a lobotomy.
In all, Freeman lobotomized 19 children under the age of 18, including a 4-year-old. By 1967, Dr. Freeman had personally performed more than 2,900 lobotomies. In February, at Herrick Memorial Hospital in Berkeley, he performed his last when a patient died of a brain hemorrhage. Freeman was stripped of his hospital privileges and soon retired from his medical practice.
So this was one of the answers. It's not known how many veterans were lobotomized. Families were distraught. What are we going to do with Uncle Joe? He's acting crazy, he's running around. And they thought this was the procedure, and of course, as exposed in the Wall Street Journal, and it was found to not be helpful at all, except in a very rare instance. And these are just some of the memoranda that I pulled up for you. They were talking about here, they needed to get informed consent. Here, talking about who should be trained. Dr. Freeman thought that, I mean, this is a neurosurgical procedure, believe me, but he thought a psychiatrist could do it. And it could be done, trained, you know, as an outpatient and procedure and done fairly quickly and inexpensively and easily. because of this, I decided to explore what happened in North Carolina at Dorothea Dix Hospital. So I got in touch with the administrators there and tried to find out how many lobotomies were done and when they were done. And not too much to my surprise, I found out that all of those records had been destroyed. So then I went down to the archives on Jones Street and really had a nice time and went through their records. A lot of things were not available because of freedom of information. Relatives might still be living. But I did find this fascinating book, Haven on the Hill, about the history of Dorothea Dix Hospital. I have no idea how many procedures were done there, but I did find some interesting things. This comes from 1933, and this is a typical diagnosis that you see patients admitted to Dorothea Dix. Dementia precox, that's what we now know is schizophrenia, was the major reason for hospitalization there. Manic depressive, Paris, that's cerebral syphilis, we don't see that anymore. Senile dementia, Alzheimer's is what we would, how we would term that today. Then pellagra caused psychosis, we don't see that, that's a vitamin deficiency. Epilepsy, you see alcoholism and substance abuse, and then just mental deficiency. There were prominent doctors here. The physicians here will recognize the name of Dr. Hubert Royster, who was the first surgeon in Raleigh. And he volunteered out at Dorothea Dix, and he makes a very, I think, prescient statement here. I entered upon this service with no false hope of curing insanity by surgical operation. So there were people back in the 30s who said, whoa, this is really not the answer. Then there were other Raleigh physicians who volunteered and did lobotomies at Dorothea Dix Hospital. I have no idea how many were done. Prominent people here in Raleigh, some of you here know of them, I won't mention names, had that procedure. This is an example there at Dorothea Dix of hydrotherapy. People were immersed in tubs of varying temperatures of water, hot and cold. They were given what is called Scotch douches or enemas, which were alternating hot and cold. There were just all sorts of cruel treatments which really were not helpful at all. And then very prominent people underwent lobotomy. This is Rosemary Kennedy, John Kennedy's younger sister. She was probably schizophrenic. And she was born in 1918, and because of her erratic behavior, her father, the rather nefarious Joe Kennedy, signed the consent for her to be lobotomized, more than likely because she was an embarrassment to the family. They didn't do it through the eye, they did it through an incision in the side of the head, the temporal area. But they went in, and while she was conscious, they made slices in the brain, and they had her quote the Lord's Prayer and count backwards, and they kept slicing until she couldn't count anymore. And after that, of course, she didn't recover, and she was institutionalized and lived really until 2005. But that was a tragic, well-known case. Rose Isabelle Williams, the sister of Tennessee Williams. Likewise, she was probably schizophrenic. She erratic behavior, outburst. She, just like Rosemary Kennedy, was hospitalized in institutions throughout her life. She was brought up in an abusive family. Her father was an alcoholic. Her mother signed the consent form for her to be lobotomized. After this, she was institutionalized for the rest of her life. Her brother, Tennessee Williams, was really affected severely by this, and many of his plays alluded to mental illness and mental treatment. For instance, Streetcar Named Desire, Blanche Dubois, carried off on a stretcher to a mental institution, the Glass Menagerie, and several other of his plays. If you're interested in movies, Taxi Driver, Robert De Niro, Vietnam veteran. He came back and drove a taxi in New York City. It's a great movie, and but he had what we now call PTSD during Vietnam. Of course, that wasn't known until 1980, but he was haunted by flashbacks and had a very tumultuous history there in New York City in the movie. Another one, you probably have seen the movie or read, One Flew Over the Cuckoo's Nest, Jack Nicholson, and he had a unknown mental issue, was sent to a mental institution where he happened to confront Nurse Ratched, and because of his handling of her, he ultimately one day was carted off and came back and had a blank stare, and he had had a lobotomy. And so these are examples of that period of time. In closing with what I have to say, I want to close maybe on a little lighter note. I've been exposed over the years to my wife, who's an English professor in the Victorian period, and so she's always telling me about how women fared during the 19th century in the Victorian era. And you know, after the Industrial Revolution, women did one of two things. Most of them, there are two classes, the low class and the upper class, and most women worked from dawn until dusk and took care of the kids in the house. But there were a few in the elite class who had nothing to do. They were educated. They had the kids, and then the husband was out, and there was just not much of a life. So very entrepreneurial doctors engaged in a situation called pelvic masseuse. And this is an actual slide from turn of the 20th century about how women's, I guess we'd call it now PTSD, was relieved by physicians. And I thought that was very interesting, and because of my wife's interest. So with that, I'm ready for any questions if you have any. Thank you so much. Yes, sir.
When we look at lobotomies today, and we say, you know, how did science go wrong, and how did so many people buy into what we today now consider to be, I'm going to say, scandalous behavior? Today, what do you see being practiced which falls into that category? Because I'm sure that there are charlatans out there that are looking for a name.
True. This could not happen. I think Ebola is a prime example of that. You see the hue and cry now, let's give them the vaccine, let's give them the pill, and you see the CDC coming out saying, look, we have to have control studies. We've got to look at this and see if it works. It's no good if you give 100 vaccines and maybe 50% of them live. They might have lived anyway. But this was another era. It was a desperate era, World War II, trying to do, what are you going to do with all of these casualties? And this doctor, you're right, happened to come along with an idea that was picked up, but that could not happen today. Yes. Yes, ma'am.
Oh, well, my mother had a lobotomy in Boston in about 1949. She was threatening suicide, and there was nothing else they could do at that time. So
And
it did change her personality 180 degrees for the worst, I'm afraid, and she did not have a happy life after that.
yes, that is exact. And probably this doctor, you might check Dr. Freeman or Dr. Watts, I bet, did that. Check with your family to see. That was the exact time. Yes,
So,
Frank?
I was driving down here late this morning and was listening to NPR. I mean, you've got to keep up. You do understand. Anyway, they had a lady there who had written a book on dogs in wartime. Dogs that came up with the same illness from battle. And they were being handled using the same pills and treatments as human beings. So
Yeah.
there's more opportunity.
Yeah, that's, yes, sir.
What types of treatment are they finding now that are effective in PTSD?
Oh, yeah, great. I should have mentioned that. Primarily now, antidepressants. If you're going to have drug therapy, counseling, psychiatric counseling is of paramount importance. But drugs like Prozac and Paxil are the mainstay. The VA is expanding its psychiatric facilities tremendously. Fayetteville is a prime example of great expansion there to offer these veterans the service. But an interesting thing that we see now at MEPS is people who not just with PTSD, but with other conditions, they might be predisposed to go see the doctor a lot, and they get service connected for low back pain or for dizziness or whatever, and they get a check then for the rest of their life for 10%, 20% disability. Then they get out and they find out, well, I'd like to go back in the military, so they come and reapply, and we see that. It sort of predisposes you to say, well, this might not be a real good candidate. But so that's what I was saying. One has to be very careful about being tagged with this diagnosis in particular. Would you want to hire someone with that diagnosis? You know, it's a big question, I think.
Is the cure rate still the 50% kind of?
Yeah. I mean, most people really, but these people who had brain injury as a result of landmine or IED, that's written about now. That they are in a different category.
I do remember after the war was over, in the 50s, that many of my father's customers, their sons came home, and they were never right again. They were always, you had to be treated with kid gloves. So I wonder what really happened to that 50%. They just disappeared into the maze of treatments that didn't work, or just try to keep them quiet. It was just a sadness.
You are correct. I even remember, and there are several physicians in here about my age who all trained and had rotations through VA hospitals. And I remember in the late 60s in Birmingham in the VA hospital seeing these veterans coming in, and they'd smoked 3 or 4 packs of tobacco a day. They were alcoholics, didn't have a job, disheveled. And even then, I knew, I mean, this was right, you know, they were 60 years old post-World War II. I knew that combat had to have done something to them terrible. The man just could not handle what these guys went through. But we didn't have a diagnosis. They never even called it combat fatigue. Yes?
What are the long-term side effects of using the drugs like Prozac and stuff like that in order to treat PTSD?
I don't think there are long-term harmful effects. But those drugs are not necessarily helpful. But they're so universally used. Goodness gracious, I hate to think how many people are taking Prozac. Yeah. Yes.
Regarding lobotomy, was it a lack of medical understanding and research, or was there a group think that took over about what was being done? Were other doctors and researchers reticent to say, hey, maybe this isn't the right thing to do? I mean, obviously we
bit of that today in different areas of science. If you are someone who doesn't go along with what is deemed the conventional wisdom or the consensus, you're not welcome in science.
Yeah, well, I think certainly when I mentioned Dr. Hubert Royster, who was a very eminent physician in this area, and he made the comment, that is not going to take care of this problem. But I think on the other hand, the country was just caught up in its desperation. But I believe really that this person operated outside of the normal medical wisdom. But I can tell you, these procedures were done at Duke, and they were done at all of the university hospitals. So it's not that they were real outliers. Yes?
Did this sort of thing, the PTSD, happen like after the Civil War? Or we just don't have any records going back that far? Or is it really because of cannons and bombs? Like, you know, the more modern warfare is worse than spearing someone with a sword?
No, I think that it's been with us as long as there's been enormous stress, but it's just not documented that well. Possibly there's documentation from the Civil War because so much is written about it. I'm just unaware of it. That's Cliff.
A couple of points I want to make. One is sort of like Donna said, desperate people and desperate families will seek desperate treatments even if they're unproven, so on and so forth. And there will always be somebody available to provide it. But number two, in our warfare today, really beginning in Vietnam as opposed to World War II and World War I, so many of the battlefield injuries survive now that would have died back then. We have evacuation, we've got field hospitals, and a lot of these people who suffer these severe injuries wouldn't have survived 50 years ago. But now they survive, and they bring the mental aspect of the recovery as well as the physical aspect of the recovery. That's probably why it's probably so many more of it now than before.
Good point. It's true.
That lady over there.
Oh, sorry.
What is your professional opinion on or recommendation for states that still employ electroshock therapy on developmentally disabled children?
I cannot answer that question. I'm not an expert there at all. I don't have any idea. Sorry. Yes, George?
It's kind of disturbing that Dr. Freeman and apparently others were going on and on for decades performing a pretty brutal operation. Were there any measures, evidently not successful, but taken against him within the medical profession or elsewhere to try to put an end to this?
Yes, he lost his license.
But not actually killed
somebody. Many people. I think that the tide had swung really just in the really what happened when Thorazine came out in '54, that sort of put the blanket on that. I think that really ended it. And then many more drugs that are much more efficacious. By the way, Thorazine was the first antipsychotic drug that was developed, and now the drugs that have superseded that in that class of risperidol is one you might have heard the name, is occasionally used for PTSD, but that's another class of severity of drugs. Yes.
What was the best case scenario outcome for a lobotomized patient? I mean, what were they actually attempting to do? I mean, just stop the psychiatric outbursts? Or?
Yeah, they tried to keep the demons away. And if you go back, and this is really a nice series, and it starts in December. If you go back in the archives, this fella who they describe in detail is now 91 years old, and he's just he resisted and resisted, and he realizes what happened to him, and that his life was forever changed, but that life was not good. And I haven't read anywhere of it really benefiting someone other than just causing the real aberrant behavior so that they might have to be institutionalized. But as you see, so many people had to be institutionalized after this.
multidisciplinary approach they use. I'm wondering if you're familiar with them. He said they've been working with concussive issues with the professional athletes for years before it even PTSD, brain trauma patients, injury patients, and he says they're having remarkable success compared to other types of treatments. So I'm wondering if you're familiar with that.
No, it's outside of my field altogether, but there are many people. There's a huge emphasis because of, injuries on the football field and otherwise. It's very helpful, and I'm sure they really are probably doing a fabulous job.
All right, Dr. Miller, thank you so much.
Thank you, Donna. Thank you.
Appreciate it very much.